Stress, as we often hear about it, is a term that holds many meanings. You may have noticed how the word stress is used to describe a variety of emotional states. But did you know that stress itself isn't necessarily an emotion? Instead, stress is more of a signal that your internal experience, your feelings, and your thoughts might not quite match what's going on around you, in the world, and in your life. In our day-to-day experiences, there are moments when everything seems to flow perfectly. Life feels easy, calm, and in balance. But at other times, we feel like there's a disconnect, where the external events that unfold around us, such as work, relationships, or personal challenges, don't quite align with our internal world. It's in these moments of misalignment that we begin to feel what we typically call stress. But stress is not inherently bad, and it's not always something to be avoided. In fact, the way stress shows up in our lives is often tied to the emotions we feel. It's like a bridge, connecting what's happening around us to how we feel inside. And as we'll explore, the way we manage stress can profoundly influence whether we feel calm, anxious, sad, or energized. When we experience stress, it triggers responses in our body. It's not just about feeling overwhelmed or anxious. Stress activates the body's natural systems, including the nervous system and the release of hormones, like cortisol. These reactions are deeply embedded in our biology, and they have a purpose. In certain situations, stress is helpful. It sharpens our focus, prepares us for action, and helps us respond to challenges more effectively. But there's a catch. Too much stress, or stress that lingers for too long, can lead to emotional and physical strain. It's not about whether stress is good or bad. It's about how we manage it and whether it's appropriate for the situation at hand. You might already know that feeling stressed can sometimes make you feel disconnected from your environment, as though your body and mind are at odds with what's happening around you. At the same time, what many people don't realize is that stress can have positive effects as well. In certain contexts, stress can actually enhance the functioning of your immune system, preparing your body to fight off illness. It helps us become more alert, more engaged with the world, and more able to cope with difficulties. So, the key is understanding when stress is serving you and when it's becoming overwhelming, creating feelings of unease. As you begin to understand this, you might realize that the way we typically categorize emotions, like happiness, sadness, or anxiety, isn't always as clear-cut as we think. Emotions themselves are a complex blend of internal experiences and external circumstances. They can feel overwhelming, but they also provide valuable information about how you're interacting with the world around you. By understanding the biological foundation of emotions and stress, you begin to realize that you're not helpless to these feelings. There are tools and strategies grounded in neuroscience and physiology that can help you regain balance when stress is high. And just as important, these tools are there to help you stay grounded when you feel the weight of the world pressing in on you. You don't need to fight these feelings. Instead, you can learn how to work with them, understanding when to lean into the stress for energy and when to let it go, allowing your body and mind to relax and restore. This understanding will help you see that stress is not simply something to avoid or dread. It's a natural part of the ebb and flow of life, and with the right tools, you can use it to your advantage. We now shift our focus to a deeper understanding of how our body and mind work together. Life is constantly pulling us in various directions. Whether you are supporting others in your life, whether through your work as a practitioner, helping your clients, or nurturing your relationships with children or a spouse, the impact of stress and emotions becomes even more evident. The way we navigate our own internal experiences affects not only our well-being, but also how we can better support those around us. Today, we're going to talk about practical tools grounded in both behavioral science and biology that you can use to manage stress, emotions, and even more complex mental health challenges like depression, PTSD, and anxiety. These tools range from simple behavioral techniques to more targeted supplementation strategies. Each one aims to help you find balance in your body and mind. It's about becoming more resilient in the face of life's challenges, and not just surviving them, but thriving as you handle them. You might already know that stress can sometimes feel overwhelming, but the truth is, stress isn't just a mental or emotional experience. It's a physiological one as well. The way we experience emotions, whether it's happiness, anxiety, or even sadness, is intricately tied to how our bodies respond. This mind-body connection is so powerful that it can dictate not only how we feel, but also how our bodies function, whether that's in terms of energy levels, immune function, or even digestion. When we experience something that brings up an emotion, like stress, we often feel it in our bodies. You might feel tension in your shoulders, a tightness in your chest, or a fluttering in your stomach. These physical sensations are not just a coincidence. They are the result of the nervous system communicating with your body. The nervous system, which includes the brain, spinal cord, and the network of nerves throughout the body, is deeply connected to the organs, such as the gut, liver, and even your spleen. All of these body systems are constantly sending signals to your brain, which in turn influences how you feel and how you act. This is why the relationship between the brain and body is so significant. For too long, we've tended to think of the brain as the primary organ that governs our emotions, but recent research has revealed just how important the body is in influencing our emotional states. The brain doesn't just control the body. The body also sends vital information to the brain that affects everything from mood to thought patterns to how we react to stress. Many people equate mindfulness with managing stress, but today we're going to step away from that idea. While mindfulness is certainly helpful in some contexts, it's often discussed in vague terms. Mindfulness tends to focus on awareness and present moment attention, but this approach can sometimes feel elusive or difficult to put into practice when stress or emotions are overwhelming. Instead, we'll dive into more objective tools, those grounded in science, that can help you take control of your emotional and physical state in concrete ways. The goal here is not to suppress or ignore emotions. Emotions are a natural part of the human experience, but the ability to regulate them, to feel in control and at ease, is an empowering skill. Rather than trying to avoid emotions or act as though they don't exist, the tools we'll discuss today will help you lean into life in a healthier, more balanced way. These tools are designed to help you feel better, physically and emotionally, and to help you regain control over your internal state when necessary. You don't need to be robotic or emotionless. In fact, it's not about numbing or suppressing your emotions. Instead, it's about understanding and using your body's natural systems to help you navigate emotional experiences more effectively. When you understand the biology and physiology behind stress and emotions, you begin to realize that you are not just reacting to life, you have the tools to shape your response. And this, in turn, will allow you to move through life with greater ease, resilience, and emotional balance. Now, let's explore the concept of stress in greater depth. Stress is something many of us feel regularly. It's something that's so common in our lives. But yet, when we think about it, it's not always clear what stress actually is. We often hear people say they're stressed out. But what does that really mean? You may have heard that stress is inherently bad, that it's an ancient remnant from times long past when humans were constantly pursued by predators like tigers or lions. The theory is that stress was meant to protect us from physical danger, like being attacked by animals, and it's somehow out of place in our modern world, filled with creature comforts. So many believe stress is something we don't need anymore, but still, it's with us. In some ways, this view is misleading. Yes, it's true that stress developed as a survival mechanism. Early humans needed it to respond quickly to threats in their environment, like predators or hostile human groups. It was a system designed to help us survive, triggering the fight or flight response. This is when stress causes a surge of energy, heightening your senses and enabling you to respond to danger rapidly. But here's where it gets interesting. Stress is not as specific as we may think. While it's often framed as a response to physical danger, stress is actually a generalized system. It was never just designed to respond to tigers or other predators. It was created to mobilize your brain and body in response to a wide variety of challenges. These challenges could be physical, sure, but they could also be social or emotional in nature. As we move forward in time, stress didn't just disappear with the advent of modern technology, weapons, and civilization. Humans, even in ancient times, faced stressors beyond physical threats. Imagine the stress of losing a loved one, the fear of the unknown when someone you cared about went off on a journey and didn't return. This kind of psychosocial stress has always been a part of the human experience, even long before the invention of phones or modern communication. The point here is that stress is not only about physical danger, it's about how your body and brain respond to a wide range of situations that feel threatening, whether they're tangible, like a physical attack, or intangible, like the fear of losing someone close to you, or dealing with emotional pain. Stress in this sense is universal. It doesn't discriminate between a tiger in the wild or the stress of losing a job or facing relationship problems. It's also important to realize that stress isn't an isolated negative experience. Stress, at its core, is a system designed to help us cope, to prepare us to respond to challenges. It works as a general purpose system. It's flexible, not rigid. This flexibility allows the body to react to various types of challenges, from physical to emotional to psychological. The critical takeaway here is that stress is not inherently bad. It's a necessary system that has evolved to help us adapt to a variety of life challenges. While the nature of the stress we experience has changed over time, from physical survival to more emotional and psychological stressors, The fundamental way stress operates in our bodies has remained the same. The stress system still helps us prepare for and respond to challenges, but how we manage it is what truly makes the difference between its positive and negative effects. Stress can be harnessed to our advantage, especially when we understand that it is a tool, not an enemy. By learning how to manage stress effectively, we can use it to build resilience and strength. Stress is not just an abstract feeling. It's deeply tied to biological mechanisms that are ingrained in us. These mechanisms were built into our bodies to help us handle challenges, and they are something we are born with. They don't require years of training or neuroplasticity to activate. The ability to manage stress is something inherent to you. It's hardwired into your physiology, designed to be used whenever you need it. Within your body, there are mechanisms for both stress and distress. Stress is your body's natural response to challenges, while distress arises when stress becomes overwhelming. These systems are encoded in our genetics, passed down through generations, ensuring that all humans, from birth to now, have the tools to manage stress. These systems are not just about preparing for stress over time, but also about how you can control your reactions in real time. These real-time tools don't require hours of practice in meditation or breathing exercises. They are tools you can use in the moment when stress hits you unexpectedly. Many research labs are focused on developing and testing these tools, understanding how we can apply them when stress arises. The knowledge and tools derived from this research can help us manage stress more effectively in our everyday lives. Understanding how the stress response works will give you a better grasp of why these tools are effective. When you have a deep understanding of the biological mechanisms that govern stress, you're in a much stronger position to handle it. Knowing how the body reacts allows you to incorporate tools into your routine that can help you stay calm, even in stressful moments. Stress and stressors are closely related. Stressors are external events, either psychological or physical, that trigger the stress response. A stressor could be something like being caught outside in the cold without proper clothing. Or it could be something like an overwhelming workload or social pressures. Both types of stressors can trigger the body's natural stress response, activating physiological changes that prepare us for action. At its core, stress doesn't distinguish between physical and emotional challenges. Whether you are facing a physical threat, such as extreme cold, or an emotional one, like anxiety over an important life event, your body responds in much the same way. Stress is a generic response system, adaptable to all sorts of situations. This flexibility is what makes it so powerful and essential. The body's immediate reaction to stress is known as the acute stress response, where the sympathetic nervous system is activated. The sympathetic nervous system is a group of neurons, known as the sympathetic chain ganglia, that runs from the neck to the abdomen. When stress hits, this system prepares the body for what is commonly known as the fight or flight response. Your body's heart rate increases, pupils dilate, and blood vessels constrict. You may feel a rush of energy, alertness, and focus, all of which are designed to help you face the challenge at hand. These physiological responses are meant to mobilize your body to either confront the stressor or escape from it. It's a natural survival mechanism. However, while the acute stress response is essential in the short term, it can become harmful if it persists for too long. If the stress response is continuously triggered, without enough time for recovery, it can lead to negative physical and emotional effects, like chronic fatigue, anxiety, and even cardiovascular issues. Understanding this helps you realize that while stress can be beneficial in the moment, it's just as important to manage it afterward so your body can return to a calm, balanced state. This is where real-time tools for managing stress come into play. By understanding how your body reacts to stress, you gain the power to regulate it. Rather than letting stress overwhelm you, you can use techniques that help your body shift back to a state of relaxation. These tools can help you navigate stressful situations with more ease, keeping you grounded and in control. At the heart of our body's stress response lies a fascinating and intricate system that involves a series of neurons and neurochemicals. While you don't need to memorize specific names, understanding how this system works can give you valuable insights into how your body reacts when stress hits. One key player in this process is the sympathetic chain ganglia, a chain of neurons running down the center of your body. When something stressful happens, whether it's a thought, a feeling, or an event in the environment, this chain of neurons is activated almost instantly, like a series of dominoes falling one after the other. This activation is incredibly fast and is one of the reasons we can react so quickly to stress. The neurons in this chain release a neurochemical called acetylcholine. This is important because acetylcholine, under normal circumstances, plays a role in muscle movement. It's what allows us to perform everyday actions like picking up a cup of coffee or writing with a pen. In the brain, acetylcholine also contributes to focus and attention. However, when we're under stress, the role of acetylcholine changes. Instead of just helping with muscle movement, it triggers a much larger physiological cascade that prepares our body to deal with stress. Under stress, you don't want all your muscles contracting at once. This would leave you in a state of complete rigidity, unable to move or act. That's something known as tonic activation, and it's something our body actively avoids. But when acetylcholine is released, it doesn't just cause muscles to contract. It also activates other neurons in the system, called postganglionic neurons. These neurons, in turn, release epinephrine, more commonly known as adrenaline, into the bloodstream. The release of adrenaline is where things start to get particularly interesting. Adrenaline affects your body in a variety of ways, particularly in parts of your body that need to be ready for action. For example, your muscles and heart are equipped with receptors that respond to epinephrine, called beta receptors. When adrenaline binds to these receptors, blood vessels in your legs dilate, allowing more blood to rush in. Your heart rate increases, and your muscles become more energized. All of this helps prepare your body to either fight or flee from the stressor at hand. But not all areas of the body need to be active when you're stressed. Some systems, like digestion and reproduction, are not essential for immediate survival in stressful situations. These functions are considered luxuries for when things are going well, so the body cleverly redirects blood away from these areas. The receptors involved in these processes, when activated by adrenaline, cause blood vessels to constrict, thereby limiting blood flow to areas like the digestive system and reproductive organs. This helps conserve resources for more critical functions during a stressful moment. This all points to the generic nature of the stress response, which I've mentioned before. It doesn't care whether the stress is caused by physical danger, emotional distress, or anything else. It simply activates a series of biological reactions designed to help the body respond effectively. These responses are broad and generalized because the body is preparing for anything, not just one specific type of threat. It's a system that has evolved over millennia to serve a very important function, to help us survive and handle whatever challenges come our way. The key takeaway here is that the stress response is not just a mental or emotional reaction. It's a whole body event involving complex systems of neurons and chemicals that prepare you to face the world. Understanding how this process works gives you a deeper awareness of how stress affects you, both physically and mentally. And with this understanding, you can begin to develop strategies to manage and control stress more effectively in your own life. The stress response is a fascinating and complex process, and there's one crucial thing to remember. It's a two-pronged system. On the one hand, certain systems within your body are activated, helping you prepare for action. On the other hand, other systems are suppressed, allowing your body to prioritize its responses to immediate challenges. This dual action process is what makes stress such an effective tool for responding to threats. But it also helps explain why stress can feel overwhelming if not managed properly. When stress kicks in, your body is saying yes to certain things. Things like heightened heart rate, increased blood flow to the muscles, and heightened alertness. These changes are essential to help you respond effectively to stress. Blood flows to areas that need it most, like your legs and heart, to fuel your body for immediate action. But at the same time, the body also says no to other systems that aren't necessary in the moment. For instance, your salivary glands are one of the first things to shut down. You may notice your throat going dry during stressful situations because less blood is being directed to those glands. This is just one example of how the body prioritizes the systems that will aid in action, while temporarily shutting down the systems that are less essential in a stressful moment. The key takeaway here is that the stress response is a prioritization system. It selectively activates certain physiological responses while deactivating others, ensuring that your body is prepared to take action. The feeling of agitation or restlessness that you experience when stressed is part of this mechanism. The stress response essentially tells you that something needs to happen. It urges you to move. This movement could take the form of physical action, perhaps running away from danger, or verbal expression, like saying something you might not normally say when you're calm. In this way, stress is not just a feeling, it's an instinct to act. This explains why, under stress, people often feel the urge to speak quickly, move urgently, or even experience tremors. It's all part of the system's design to push you into action. However, it's also important to recognize that when stress arises, if we try to suppress this natural impulse to move or react, it can cause discomfort. The agitation we feel is the body's way of signaling that it wants to act. Now that we've explored how the stress response works, let's focus on how to manage it, especially in real time. This is where the real challenge and the real opportunity lies. Imagine you're about to step onto a stage to give a presentation, or you're about to speak in a Zoom meeting, and suddenly you feel your heart racing, your hands trembling, and your body going into overdrive. How do you calm down in those moments? The best tools for managing stress quickly are those that have a direct line to the autonomic nervous system. The autonomic nervous system controls things like heart rate, digestion, and overall alertness. things that happen automatically without us needing to think about them. While we don't have full control over the autonomic nervous system, there are entry points that allow us to influence it. One of the biggest misconceptions when it comes to controlling stress is telling yourself to calm down. Simply trying to calm down doesn't usually work. In fact, this can sometimes make the situation worse as it adds pressure and frustration. The key is to use tools that bypass that internal struggle and directly affect the autonomic nervous system, helping to restore balance to your body's response to stress. Real-time tools that have a direct impact on your autonomic nervous system are what allow you to reduce stress quickly and regain a sense of calm. These tools don't require a lot of preparation or long-term practice. They can be applied in the moment, helping you regain control of your body and mind, even when stress is running high. When stress hits, one of the worst things you can do is try to force yourself or someone else to calm down. This usually only exacerbates the situation. Instead, to reduce the intensity of the stress response, the most effective strategy is to activate the system in your body that's designed specifically for calming and relaxation. That system is known as the parasympathetic nervous system. The parasympathetic nervous system works in tandem with the sympathetic nervous system, which, as we discussed earlier, is responsible for the stress or fight or flight response. While the sympathetic system gears your body up for action, the parasympathetic system does the opposite. It's responsible for bringing the body back to a state of calm, promoting rest and recovery. Understanding how this system works is key to managing stress in real time. The parasympathetic nervous system has several important components. Many of these components are located in the cranial nerves, which are positioned in the brainstem and neck area. These nerves have a direct connection to several important functions in your body, including the control of eye movements, pupil dilation, and even your facial muscles. But perhaps most crucially, the parasympathetic system also influences your airway, your throat, and your lungs. Interestingly, the parasympathetic system is also responsible for controlling certain parts of the pelvic region, like the genitals, bladder, and rectum. However, these areas aren't directly controlled in the same way as facial muscles or the eyes. The signals need to travel from the brain to the spinal cord and then out to these organs. What makes the parasympathetic nervous system particularly interesting, however, is its ability to be activated through specific entry points or levers that you can use to regulate your stress levels. By learning how to activate these levers, you can push back against the stress response and calm yourself down in real time without waiting for the stress to subside on its own. Now, I'm going to introduce the first tool you can use to activate the parasympathetic nervous system: the physiological sigh. The physiological sigh is one of the fastest and most scientifically grounded techniques for calming yourself down when stress arises. It's a natural mechanism that you probably already use without thinking about it. In fact, we all do it involuntarily at times, especially when we're trying to relieve tension or get a little extra oxygen into our bodies. But here's the fascinating part. You can learn to use the physiological sigh voluntarily, which gives you control over your stress response when you need it most. The technique is simple, and it has been thoroughly researched by labs, including studies conducted in my own lab and by Dr. Jack Feldman at UCLA. So how does the physiological sigh work? It involves taking a deep, double breath. First, you take a deep breath in through your nose, filling your lungs completely. Then, without pausing, you take a second, smaller inhale before letting it all out in a long exhale through your mouth. This double inhale and long exhale technique has been shown to activate the parasympathetic nervous system almost instantly, helping to counteract the physiological effects of stress. What's happening in the body when you perform the physiological sigh is that the lungs get a chance to fully expand and release carbon dioxide, which naturally helps bring your heart rate down. The deep inhalation sends signals to your brain, telling it that it's time to relax. This simple technique gives you a direct way to calm your body and mind when stress arises. There's no need for any complicated breathwork routines or meditation practices. The physiological sigh works quickly and can be done anywhere, whether you're standing in line at the grocery store, sitting in a meeting, or even during a stressful moment at home. The more you practice using this tool, the more natural it will feel, and the easier it will become to control your stress response in real time. Breathing techniques, such as breath work, have been gaining a lot of attention recently. Many people practice deliberate breathing for minutes at a time to shift their physiology or access certain mental states. While breath work certainly has its utility, what we're focusing on here is something much simpler, more immediate, and deeply grounded in the physiological relationship between the brain, body, and breathing apparatus, specifically the diaphragm, lungs, and heart. Let's start with the hallmark of the stress response: heart rate. When stress activates the body, one of the first responses is an increased heart rate. The heart beats faster to prepare the body to act, to fight or flee. Blood is directed away from systems that aren't essential in the moment, like digestion, and sent to the big muscles that will help you move quickly. You might also feel your face flush as blood rushes to your muscles. All these changes are part of the body's fight or flight response, and they're meant to give you the energy and alertness needed to deal with a stressful event. For most people, heart rate is perceived as an involuntary process. Your heart beats faster when you're active and slower when you're at rest. However, the reality is that heart rate isn't purely autonomic. It's something you can influence. For example, you can speed up your heart rate by running or slow it down by walking or lying down. But there's an even more direct way to control your heart rate through your breath. Here's how it works. When you inhale, whether through your nose or mouth, your diaphragm, a skeletal muscle at the base of your lungs moves down. As your lungs expand, there's more space in the chest cavity, and your heart physically enlarges to accommodate that space. This is not an emotional enlargement. It's a physical process where your heart expands to make room for more blood to flow through it. As a result, when your heart gets larger during inhalation, the blood inside it moves more slowly, as there's now more room inside the heart. A small group of neurons inside your heart, called the sinoatrial node, detect this change in blood flow. They send a signal to the brain, informing it that blood is moving more slowly through the heart. The brain then responds by sending a signal back to the heart, telling it to speed up. So what does this mean for stress management? Simply put, the length and intensity of your inhale play a direct role in controlling your heart rate. If you inhale more deeply and for a longer period than you exhale, you're signaling to your heart to speed up. The more vigorously you inhale, the more your heart will respond by increasing its pace. This is where the physiological sigh comes in. It's a technique that uses this very principle to calm the body and reduce the stress response. The sigh involves taking a deep, full breath in and then completing the inhale with a second, shorter breath. Then, you exhale fully. By controlling the length and depth of your inhales and exhales, you can actively influence your heart rate and, as a result, help lower your overall stress levels. The beauty of this technique is that it's voluntary. While the stress response activates automatically, you have the power to regulate it by consciously controlling your breath. You don't need a complicated breathwork routine. Just a simple, deep physiological sigh can activate the parasympathetic nervous system and bring your body back to a state of calm. This tool is grounded in neuroscience and physiology, making it one of the most effective and accessible ways to manage stress in real time. It's a technique that can be used anywhere, at any time, whether you're in a high-pressure meeting, on stage giving a presentation, or simply trying to quiet your mind before bed. By learning to harness your breath in this way, you gain a powerful tool to manage your body's stress response and feel more in control. When you inhale deeply, your diaphragm moves downward, and your heart physically expands to accommodate the increased space in the chest. This causes blood to flow more slowly, as it has more room to circulate. The sinoatrial node in the heart detects this slower blood flow and sends a signal to the brain, which then signals the heart to speed up. In simpler terms, if your inhales are longer or more vigorous than your exhales, you're signaling your body to speed up your heart rate, which is part of the stress response. Now, if you want to calm your heart rate and counteract the stress response, you can do the opposite. During exhalation, your diaphragm moves upward, compressing the heart and making it smaller. As the heart gets more compact, blood flows faster through the heart, kind of like a pipe getting smaller and pushing the blood through more quickly. This action is detected by the sinoatrial node, which signals the brain to slow down the heart rate, initiating the parasympathetic nervous system response. Therefore, to slow your heart rate, you want your exhales to be longer or more vigorous than your inhales. This physiological relationship between breathing and heart rate makes the technique incredibly effective for calming stress quickly. The best part is that it works in real time. You don't need to prepare or practice for long periods like you would with other forms of breath work. You can activate this system instantly, right when you need it most. Whether you're feeling overwhelmed before a meeting or experiencing anxiety in a stressful situation, adjusting the balance between your inhales and exhales can help you regain control over your body's stress response. The physiological sigh takes this concept a step further. Discovered in the 1930s and later explored in greater detail by research labs at UCLA and Stanford, the physiological sigh is a natural response that humans and animals use when preparing to fall asleep or when recovering from periods of intense emotional distress. It's a deep, double inhale followed by a long exhale. This sigh happens when carbon dioxide builds up in your system, signaling your body to expel excess air and regain balance. Humans often engage in this sigh after crying, when they're trying to recover their breath, or even when they're in environments that feel suffocating. The beauty of the diaphragm, the muscle that drives this process, is that it's one of the few internal organs we can control voluntarily. Unlike your pancreas or spleen, which work automatically, the diaphragm can be consciously engaged to affect your heart rate and breath. This makes the physiological sigh not only a natural response, but also a powerful tool for self-regulation. It can calm your body almost instantly, reducing the immediate physiological impact of stress. By learning to use the physiological sigh, you can tap into a simple yet effective way to calm your mind and body when stress strikes. The beauty of the diaphragm and the phrenic nerve is that they allow you to consciously control a process that normally runs in the background of your body. This amazing pathway, connecting your brain to your diaphragm, lets you intentionally control your breath whenever you want. You don't need to wait for it to happen naturally. You can use it at any time to help regulate your body's stress response. With the ability to control your diaphragm, you have a tool at your disposal that can help you manage stress in real time. You can experiment with your breath, intentionally increasing your inhales or making your exhales longer. This control is invaluable, especially when you feel that sense of agitation or tension creeping up. A particularly effective technique is the physiological sigh, which involves a double inhale followed by a long exhale. This might sound contradictory to what I mentioned earlier, where deeper inhalations are tied to increased heart rate and stress. However, the physiological sigh works differently. Here's why: when you take a double inhale, even if the second inhale is just a tiny bit more than the first, it helps to reinflate the tiny sacs in your lungs called alveoli. These alveoli provide an immense surface area, about the size of a tennis court if spread out, which allows for better oxygen exchange. Under stress, these tiny air sacs collapse, making it harder for your body to expel carbon dioxide and take in fresh oxygen. The second inhale of the sigh helps re-expand those collapsed alveoli, allowing your lungs to function more efficiently. Then, when you release the long exhale, it becomes far more effective at clearing out the excess carbon dioxide that builds up in your bloodstream during stress. This clearing process helps your body relax, reducing the agitation and jitteriness you might feel when your stress response is active. This process is hardwired into your body, and it's one of the fastest ways to reduce stress in real time. It bypasses the need for extensive training or preparation. It's simple and accessible whenever you need it most. Scientists in my lab, alongside experts at Stanford, are exploring how the physiological sigh and other breathing patterns can modulate stress responses and emotional states. While the studies are ongoing, there's already strong evidence to suggest that this technique is highly effective for quickly calming your body during stressful moments. The physiological sigh works because it directly activates your body's natural mechanisms to regulate stress. It's a tool that anyone can use, anywhere, without needing to be in a special setting or devote time to a lengthy practice. It's especially useful when life catches you off guard. Whether you're feeling overwhelmed by a relationship issue, financial stress, or a physical challenge, when you're feeling more alert or activated than you'd like, you can turn to the physiological sigh to calm your body quickly and effectively. This is the beauty of the physiological sigh. It's not just a technique for long-term relaxation or mindfulness. It's a real-time tool that works with your body's natural systems to help you reset in the moment. It's immediate, simple, and incredibly effective. A crucial aspect of how we function is that it's incredibly difficult to control the mind using only the mind, especially when we are in a heightened state of activation, such as feeling overly alert or very tired. In these states, it becomes challenging to employ top-down mechanisms, such as intention or gratitude, which are otherwise powerful tools when we're in a more balanced state. When you are either very alert and stressed or extremely tired, It's hard to control your thoughts or emotions just by trying to think your way out of the situation. However, one of the best ways to bring your level of autonomic activation, basically your level of alertness down in these states, is by using the physiological sigh. This simple technique can help you calm down when stress hits. Whether you're at the bank, in a crowded room, or simply feeling overwhelmed by the demands of the day, the physiological sigh works quickly. Just 1 to 3 cycles of the double inhale-exhale pattern can reduce your stress levels almost immediately. This technique is arguably one of the fastest ways to calm down, especially in situations where you're feeling overwhelmed. The beauty of the sigh is its simplicity. When you're stressed, you don't need to engage in long breathing exercises or meditation. Instead, a few deliberate inhales and exhales can help you regain control over your stress response. However, it's important to note a key detail about using the physiological sigh to lower your stress. Many people might expect their heart rate to decrease rapidly when using this technique, but it's important to understand that a rapid decrease in heart rate is actually not ideal. There's a phenomenon called the vasovagal response, where people sometimes faint after standing up quickly or experiencing a sudden drop in heart rate. This is often triggered when the body's calming response is too abrupt. When using techniques like the physiological sigh, you don't want your heart rate to drop too fast. It's better for your heart rate to come down gradually over the course of 20 to 30 seconds. If you find that your heart rate isn't slowing down as quickly as you'd like, don't worry. You may need to repeat the physiological sigh a few times to fully calm your body down. This method is gentle and works with your body's natural rhythms to bring you back to a state of calm. Another powerful effect of using the physiological sigh, or exhale-emphasized breathing, is that it shifts the dynamics between the body and the mind. When you're feeling agitated, stressed, or worried, using a physical tool like the sigh not only calms your body, but it also makes your mind more available for processing the stress you're feeling. In other words, once you've activated the parasympathetic nervous system and calmed your body down, your mind becomes more capable of reflecting on the situation and responding to it in a thoughtful, measured way. This is one of the most powerful aspects of using breath techniques to control stress. They don't just calm your body, they make your mind more capable of managing your emotional state. By calming the body first, you create the mental space to handle the stressor more effectively. Whether it's a challenging situation or a difficult emotion, the sweet spot in life, especially when you're not trying to sleep, is to find a balance between being alert and being calm. This is where your body and mind function optimally, allowing you to handle life's challenges with clarity and ease. The physiological sigh is an excellent tool to help bring you back into this balanced state, especially when stress or anxiety is making it hard for you to relax or focus. For those of you who struggle with sleeping, or even just relaxing during the day, the physiological sigh can be repeated multiple times, up to 10 or 15 cycles if needed. In fact, some people find that this technique helps them fall asleep, especially if they're lying down while reading or winding down. The deep inhales and long exhales can promote a calm state, and when done several times in succession, it can be the perfect way to drift off to sleep. What's fascinating about breathwork in general is that different techniques can either activate or relax the body, depending on how you use your breath. Most breathwork protocols, those methods you might do separately from daily life, during dedicated relaxation sessions, are designed in a way that longer and more vigorous inhales tend to activate the body and make you feel more alert. On the other hand, longer and more vigorous exhales are typically used to promote relaxation, and in some cases to help with falling asleep. The physiological sigh stands out because it is intended to be used in real time whenever you need it. It's a practical tool that fits seamlessly into your daily life. There's no need for a special time or place. Whether you're feeling stressed in the middle of a conversation or you need to calm down after an overwhelming moment, the physiological sigh provides a simple, effective way to regain control. A quick note about nasal versus mouth breathing. There's a growing body of research, highlighted by books like Breath, The New Science of a Lost Art by James Nestor and Jaws, by Sandra Kahn and Paul Ehrlich, that emphasizes the benefits of nasal breathing over mouth breathing. Nasal breathing offers a variety of advantages, including better facial structure, improved immune defense, and enhanced overall health. That being said, for the physiological sigh, the best approach is to double inhale through the nose and exhale through the mouth. However, if you find that you can only breathe through your mouth or prefer to do it all through your nose, that's perfectly fine as well. The effectiveness of the physiological sigh remains the same regardless of the breathing path you use. Now, let's dive a bit deeper into the underlying neuroscience behind this. You have two main breathing centers in your brain that control rhythmic breathing, one for regular inhalation and exhalation, and another for the more irregular patterns, like doubling up on the inhales or exhales. These centers are located in the pre-Butzinger nucleus and the parafacial nucleus, both of which were discovered by Jack Feldman at UCLA. The parafacial nucleus, in particular, is activated when you perform a double inhale or exhale, helping your body to regulate the rhythm of your breathing in a way that is natural and efficient, especially during speech or while managing stress. This neurological mechanism is why doubling your inhales or exhales works so effectively for calming down. You're engaging a part of your brain that is designed to regulate the flow of oxygen and carbon dioxide in the body, making it easier for you to regain composure when stress arises. The physiological sigh, then, is not just an instinctive action, but a powerful tool that works with your body's natural systems to help you relax, refocus, and regain balance in real time. The parafacial nucleus, a crucial part of the brainstem, plays a unique role in regulating not just your breath, but other important features of your body. One fascinating aspect of this nucleus is that, because it's located near neurons responsible for controlling facial muscles, it also helps to relax the jaw. This interaction between different neurons allows the physiological sigh to trigger a cascade of calming effects throughout the body. It's why, when you practice the physiological sigh, you might notice that your jaw relaxes, your tongue feels less tense, and your face softens. These physical changes can help you feel more relaxed and even prevent you from saying things you might regret when stressed. This connection between breathing and facial muscles is a reflection of the parasympathetic nervous system in action. The parasympathetic system is the body's natural calming system, designed to help us regulate stress. These calming neurons are embedded deep within our biology, working together to manage the muscles of the face, eyes, and jaw, and helping you respond calmly even in stressful situations. It's no wonder that when you're stressed, it can be hard to speak clearly or maintain control over your body. Stress activates neurons in the spinal cord, while the parasympathetic nervous system helps us regain control and calm. By understanding this neuroscience, you now have a tool, the physiological sigh, to help regulate your stress. You've learned that exhale-emphasized breathing will slow your heart rate, while inhale-emphasized breathing speeds it up. But let's take it a step further and explore stress from a different perspective, not by simply labeling it as good or bad, but by considering it on three different timescales: short-term, medium-term, and long-term. Understanding stress in this way can give us deeper insights into how it influences emotions and overall emotional well-being. Stress is often portrayed as something harmful, something to be avoided at all costs. We've all seen images that depict the brain under stress. The healthy brain is plump and full, while the stressed brain appears smaller and withered. We see how stress negatively affects the hippocampus, the area of the brain responsible for memory, making it smaller in stressed individuals. We hear how stress can worsen conditions like Alzheimer's, or increase the likelihood of schizophrenia episodes in those who are genetically predisposed. What's clear from all these studies is that chronic stress is bad for us. It can have lasting negative effects on brain function and overall health. But let's shift focus and consider how stress can be beneficial in the short term, helping us adapt and respond effectively to immediate challenges. The real question is, how can we manage stress across different timescales, and how does it relate to our emotional well-being? We've all heard it before. Stress is bad for you. We've seen studies showing how stress impacts the brain, leading to shrinkage of the hippocampus, contributing to conditions like Alzheimer's and schizophrenia, and even leading to relapse and addiction. It's clear that chronic stress has a host of negative consequences on our health. However, in all the discussions about the harms of stress, we tend to overlook something very important: the positive effects of stress, especially in the short term. Stress isn't inherently bad. Yes, long-term chronic stress is harmful. But what about the acute stress response? How does stress, in its short-term form, actually benefit us? It's a question that's rarely addressed. Most of the time, we hear that stress is universally bad, and we fail to recognize the distinction between short-term and long-term stress. So what qualifies as short-term stress? Is it 5 minutes of pressure before a big presentation? Or is it the stress of final exams that lasts for a few days? Or perhaps the ongoing stress of working on a large project, like a senior thesis? There are no clear boundaries or definitions, which leads to confusion when it comes to understanding how stress truly affects us. Let's clear up some of this confusion with the help of scientific data. Acute stress, when the body is experiencing a short-term stressor, can actually be good for your immune system. This might be surprising, but it's absolutely true. Stress in the form of a bacterial or viral infection triggers a response in the body that activates immune defense mechanisms. The same brain centers that trigger the physical fight or flight response also activate pathways that deploy killer cells in your body, cells from your spleen that go out and seek to destroy incoming bacteria or viruses. The release of adrenaline or epinephrine, the stress hormones, also plays a crucial role in this immune response, helping your body fight off infections. This short-term stress response is incredibly beneficial in defending against pathogens. Unfortunately, this aspect of stress is often overlooked in mainstream discussions. But it's one of the reasons why stress, in moderation, can be vital for our survival. This process isn't about triggering stress unnecessarily, but understanding that acute stress, like when you experience a brief shock or surprise, can mobilize your immune system and enhance its ability to protect you. Building on this idea, respiratory techniques can be used to artificially activate the stress response. These breathing techniques, like the physiological sigh or exhale-emphasized breathing, can stimulate the body's stress mechanisms in a controlled way. This doesn't mean you should walk around trying to create stress for yourself, but breathing in certain patterns can trigger the release of adrenaline and activate your immune system, offering an extra layer of protection in certain situations. This concept ties back to our earlier discussions about how breathing directly influences the autonomic nervous system. Now let's take a step back and consider the broader impacts of acute stress. While it does narrow your focus, this narrowing is actually helpful in certain contexts. Under stress, your body and brain work together to sharpen cognition. This means your brain becomes more focused and alert, helping you tackle specific challenges more efficiently. You're not seeing the big picture as much, but you are hyper-focused on the task at hand, whether it's solving a problem or handling a difficult situation. This heightened state of focus is why many people feel like they perform better under pressure. It's a survival mechanism that directs all your mental and physical energy to the task that needs to be done immediately. In short, short-term stress can be an ally. It's a natural response that activates your body's systems in ways that are advantageous for immediate challenges. It sharpens focus, enhances cognitive abilities, and helps the immune system protect you. So rather than seeing stress as an entirely negative experience, it's important to recognize its potential benefits when it occurs in small, manageable doses. Your body's response to stress is incredibly versatile, whether the stressor is psychological, physical, or external. Like a bacterial or viral infection, the stress response is generic. It's designed to help you respond to whatever challenge comes your way. This is why, when stress hits, you see changes in your body that prime your system for better cognition, increased focus, and enhanced immune function. The activation of your stress response, especially the release of adrenaline from the adrenal glands, also triggers the immune system to release killer cells that fight infection. This is one of the reasons that stress, particularly in short bursts, can be useful. Stress mobilizes your body to fight back against whatever is threatening it, whether it's a physical injury, emotional distress, or infection. This is the core of the stress response, the ability to adapt and react to threats, and the release of adrenaline plays a significant role in this process, providing your body with the energy and focus it needs to handle whatever comes your way. One example of how stress can be harnessed in a beneficial way is through Wim Hof breathing. Named after the Dutch daredevil known as the Iceman, Wim Hof developed a breathing protocol based on an ancient method called tummo breathing. While Hof is known for his extreme feats, such as swimming under icebergs and climbing Mount Kilimanjaro in just shorts, his breathing technique has a scientific basis. It involves deliberate hyperventilation, rapid, controlled breaths done over a series of cycles. The idea behind Wim Hof breathing is to intentionally release adrenaline in the body. When you engage in this type of hyperventilation, typically involving around 25 cycles of deep breaths in through the nose and out through the mouth, or sometimes just through the mouth, The body responds by releasing adrenaline from the adrenal glands. This process mimics what happens during a stressful event, helping you become more alert and focused. However, it's important to note that rapid breathing can also trigger feelings of anxiety in some people, especially those who are prone to it. This is because the release of adrenaline, though helpful in many situations, can cause an intense feeling of heightened alertness or even panic. For those with anxiety, this rapid breathing may actually induce an anxiety attack, as the body's stress response is activated more intensely than intended. Why does this happen? The key is in the adrenaline release. Adrenaline is a powerful hormone that increases heart rate, sharpens focus, and prepares your body for action. In situations like cold exposure, a stressor in and of itself, adrenaline is released to help the body react to the cold. Wim Hof discovered that by using specific breathing techniques, he could activate the same adrenaline response as cold exposure without needing to actually immerse himself in ice-cold water. So, what does this mean for us? The connection between stress and breathing techniques shows us how we can control the stress response through deliberate breathing, Wim Hof breathing, Tummo, or other similar techniques. Activate the stress response in a controlled way, allowing you to feel alert, focused, and ready to take on challenges. But as with any tool, it's important to use it appropriately and understand how your body responds to it. For some, the adrenaline release may be energizing, but for others, it may feel overwhelming. By understanding the connection between breathing patterns and stress responses, you can make more informed choices about how to manage stress in a way that benefits you. Whether you're using Wim Hof breathing to increase alertness or practicing exhale-emphasized breathing to calm yourself down, these tools allow you to harness your body's natural stress response in a way that suits your needs. When adrenaline is released from your adrenal glands, it prepares your body to deal with various challenges. One crucial function of this stress response, often overlooked, is its ability to help combat infections. Whether you engage in breathing techniques like Wim Hof's method, take a cold shower, or immerse yourself in an ice bath, the release of adrenaline is a key component of the body's acute stress response. This release is not just a physical or mental reaction to stress. It also plays an important role in protecting your body from illness. In essence, stress in its short-term form is designed to mobilize your body's defense mechanisms, making it better equipped to fight off bacterial and viral infections. This is a concept that's often overlooked when we discuss the negative effects of stress. But as we've seen, the body's ability to release adrenaline during stress provides a powerful immune boost, helping to suppress infections by mobilizing immune cells. A landmark study published in the Proceedings of the National Academy of Sciences, Kynan, demonstrated this phenomenon beautifully. In the study, participants were injected with endotoxins, which are substances that mimic an infection by triggering symptoms like fever, nausea, and general malaise. Essentially, endotoxins are like a stand-in for bacterial infection, creating symptoms that make you feel as though you're sick. Here's where it gets interesting. Half of the participants engaged in a breathing protocol similar to Wim Hof's method. 25 deep inhales and exhales, followed by holding their breath. They repeated this cycle multiple times. After completing this series of breaths, the body responds by releasing adrenaline. What's remarkable is that this group, despite being injected with endotoxins, experienced no significant symptoms. They didn't feel feverish, nauseous, or fatigued. Their bodies were able to combat the infection much more effectively than those who didn't engage in the breathing protocol. This demonstrates that short-term stress, through controlled breathing or cold exposure, enhances the body's immune response, reducing the symptoms of infection. The adrenaline release during these practices primed the body's immune system to fight off the bacteria, preventing the usual sickness response. This finding shows how acute stress, which is typically thought of as harmful, can have a protective effect under the right circumstances. However, there are safety concerns with such breathing techniques, especially when combined with other stressors. For instance, breath-holding techniques should never be practiced near water, as the risk of shallow water blackout, a type of fainting, is very real. It's essential to approach these techniques with caution and to consult with a doctor if you have any underlying health conditions, such as glaucoma or other eye pressure concerns. Despite these precautions, the results of this study underscore the power of the body's acute stress response and its ability to use stress to protect against external threats like infection. The release of adrenaline from stress not only prepares the body for action, but also enhances its immune defenses, making it more capable of fighting off harmful invaders. Imagine you're out on a hike and, unfortunately, you cut yourself deeply. What happens next is something most people would find alarming: inflammation. We often hear that inflammation is bad, that it's a contributor to diseases like Alzheimer's or other chronic conditions. But what's often overlooked is that inflammation is a natural and necessary response in the body. It's part of the body's healing process. When you get injured, your body immediately recruits immune cells like macrophages or microglia in the brain to the site of injury. These cells act like little ambulances, rushing to the area to clean up any damage and begin the repair process. This inflammatory response might look and feel uncomfortable, but it's crucial for healing. Without it, your body would struggle to recover from injuries. Similarly, this process is part of how your body responds to stress. When stress hits, whether from physical injury, emotional challenges, or other stressors, your body becomes primed to deal with the situation by activating various biological systems, including immune responses. In the short term, this is a good thing. Short-term stress helps you heal wounds, fight off infections, and stay focused. But what happens when stress becomes chronic or overwhelming? This is where the balance must come into play. Short-term stress, like the acute stress response we just discussed, is great because it enhances your body's ability to handle challenges. However, when stress becomes prolonged without proper recovery, it can have the opposite effect, weakening your immune system and leaving you vulnerable. For those of you who experience procrastination, stress is actually playing a big role. Stress is a powerful nootropic. It's essentially a brain stimulant. When you're faced with a deadline, that looming sense of failure or the desire to do well actually increases your focus and mental sharpness. It's the body's natural way of gearing up for a challenge, and it helps you get things done. The stress of an impending deadline can be the most powerful motivator, even more so than caffeine or any other cognitive enhancer. The issue arises when this type of stress is not managed properly. The key to making stress work for you is being able to turn it off when it's no longer needed. It's great to harness the power of acute stress for focus, immune function, and overcoming challenges. But, as we all know, there comes a time when you need to rest. This is when many people make the mistake of not allowing their body to fully recover. For example, you might spend weeks working non-stop, constantly feeling stressed, and then finally take a break. You think that once you've relaxed, you'll feel fine, but instead you get sick. This is because your adrenaline response has crashed, and with it, your immune system. When you don't give your body enough time to recuperate from stress, the adrenaline and other stress hormones dissipate too quickly, leaving you vulnerable to illness. So when is the right time to relax? It's important to recognize that long-term stress can take a toll on your body's ability to fight off infection and maintain balance. But the duration of stress varies from person to person. A rule of thumb is that when you're unable to get good sleep, and by that I mean the kind of sleep that helps you feel restored and refreshed, then your body is moving away from acute stress and into chronic stress. Chronic stress disrupts the natural rhythms of your body, weakening your ability to respond to challenges and leaving you more susceptible to illness and emotional burnout. The bottom line is that short-term stress is vital for performance, immune function, and healing. But recovery is just as essential. If you don't give your body the time it needs to rest and restore, you risk letting stress become detrimental rather than beneficial. One of the key aspects of dealing with stress is learning to turn off the stress response when it's no longer needed. If there's one message I hope resonates, it's that we need to learn how to switch off the stress response from an early age and continue practicing this throughout our lives. The ability to regulate stress is crucial, and the best part is that we have tools to help us do so. Physiological sighs, for instance, are one of those tools that can help us manage stress, but we also need to intentionally activate the stress response at times when it's beneficial. For example, practices like ice baths, cold showers, and breathing techniques like Tomo or Wim Hof breathing help activate the stress response for short-term health benefits, such as fighting infections or boosting alertness. However, the key is to know when to apply the brakes and calm the body down when the stress is no longer needed. If there's one thing I would wish for everyone, it's to understand the power of controlling their stress response. We have the ability to intentionally activate stress when needed, whether through deliberate breathing or exposure to cold, but we also need to know how to turn it off effectively. When I personally feel the onset of illness, say a tickle in my throat, or a general feeling of fatigue, I use breathing exercises. I take about 25-30 deep breaths, followed by an exhale hold. After completing several cycles of this, I'll hold my breath for as long as I can, then inhale deeply and hold again. I do this to stimulate adrenaline production, which in turn activates my immune system to combat the potential infection. It's important to note that I've discussed this with my doctor and confirmed that it's safe for me, and I recommend doing the same for anyone interested in trying similar techniques. But not everyone is comfortable with this approach. Some prefer cold exposure, like ice baths or cold showers, which also triggers adrenaline release and boosts the immune system. However, whatever method you choose, the end result is the same. The body is primed to fight infections or other stressors. The key is knowing when to activate this system, and just as importantly, when to turn it off once the immediate need has passed. Let's now look at medium-term stress. stress that lasts anywhere from several days to a few weeks. This could occur when we have a particularly busy period in our lives. For example, I'm currently balancing several responsibilities, including teaching a course, conducting research, and managing a lab. While I enjoy these activities immensely, they are pushing me closer to my stress threshold, that point where any small, seemingly trivial issue, like not being able to log on to a website, feels like a monumental stressor. What exactly is a stress threshold? It's essentially the point at which your ability to cognitively re-regulate the stress response breaks down. Under normal conditions, I'd find a minor technical issue frustrating, but manageable. However, when I'm already near my threshold, those small problems feel magnified. That's because my cognitive resources are already taxed, and the body's systems are on high alert. This is where we get into the idea of unifying mind and body. People often talk about this concept, being at one with our mind and body, but without clear specificity. What does it really mean to unify mind and body? It's not about some ethereal connection. It's about recognizing when your mind and body are aligned in a way that allows you to manage stress effectively. You need to be able to recognize when you're reaching your stress threshold and employ techniques to re-regulate both your physical and mental states. This means using tools like breathing exercises, taking breaks, or simply stepping back to gain perspective when stress feels overwhelming. Understanding your stress threshold and how to manage it is key to avoiding burnout and maintaining a healthy balance between stress and recovery. When you know how to cognitively regulate your stress, you're better equipped to handle life's challenges without letting stress take control. Sometimes, people experience a phenomenon known as somatoparaphrenia, a clinical condition where individuals feel disconnected from their limbs. This can be so severe that some sufferers even seek amputation, trying to convince doctors to remove parts of their body. It's a tragic condition, and it's caused by changes in the brain's central maps that govern body awareness. Most of us, however, feel deeply connected to our bodies, and when stress hits, we feel it throughout our mind and body. This sense of mind-body connection is part of what allows us to respond to stress in a way that helps us cope with everyday challenges. When it comes to medium-term stress, stress that lasts for days or weeks, it's about learning how to raise your stress threshold. In simple terms, it's about increasing your capacity to handle stress without getting overwhelmed. The goal isn't to remove stress from your life entirely, but to build up resilience so that when stress hits, you're better equipped to handle it without it negatively impacting your mental or physical well-being. There are simple tools that can help increase your stress threshold. Many of these involve deliberately placing yourself in situations where your adrenaline levels rise, but without pushing them to extreme levels. The idea is to flood your system with adrenaline in a controlled way, so you can become comfortable with that physiological response. This allows you to manage the stress when it naturally occurs, instead of feeling overwhelmed. For example, many people turn to cold showers or ice baths as a way to trigger adrenaline in a controlled setting. The shock of cold water triggers a stress response, and your body begins to release adrenaline to help you handle the sudden change. This adrenaline boost can be a healthy way to push your limits in a safe, manageable environment. Similarly, exercise, especially high-intensity workouts, can also achieve the same effect, pushing your heart rate to a higher level than you're comfortable with, and experiencing that familiar burn in your muscles. is another way to stimulate the body's stress response. You may feel your muscles aching, your heart racing, and your breath quickening. While it might feel intense in the moment, the key is to remain calm mentally while your body is activated. This is the heart of stress inoculation, learning to relax your mind while your body is under physical stress. This will help you manage high levels of stress in the future. The benefit of training your body and mind to handle these stressors is that it raises your stress threshold. What used to feel overwhelming, like a challenging workout or a high-pressure situation, will become more manageable as you build up your ability to tolerate stress. This is a form of mental resilience. By repeatedly exposing yourself to controlled stressors, you increase your capacity to handle future stress without feeling overwhelmed. To practice this, you can do something as simple as sprinting or using cyclic hyperoxygenation breathing, like the Wim Hof method. These techniques raise your heart rate, activate your stress response, and help you practice calming your mind while your body is in a heightened state. As long as you're clear with your doctor and your health allows it, these techniques can be used to help you expand your stress tolerance. Ultimately, increasing your stress threshold isn't about eliminating stress from your life. It's about learning how to respond to it effectively. By training your body and mind to handle increasing levels of stress, you become better prepared to face challenges and obstacles in the future without being overwhelmed by them. When you're pushing your body to its limits, whether on a bike, during a run, or in any high-intensity workout, your heart rate increases, and your body enters a heightened state of activation. It's this activation that allows you to perform physically at your best. However, what often happens when we're in such a state is that our mind tends to follow suit. Stress and physical exertion often lead to mental tension, making it harder to focus or stay calm. So, how do you calm your mind while your body is in a high output state? The key lies in the physiology of the body, specifically the visual system. When you're stressed, one of the immediate physiological responses is that your pupils dilate, which is part of the body's natural fight-or-flight reaction. This dilation actually creates tunnel vision, narrowing your focus to the task at hand, whether it's avoiding danger or pushing yourself during a workout. The problem with this is that it narrows your mental perspective, which can contribute to feelings of anxiety or stress. To counteract this, you can use a technique called deliberate gaze dilation. Rather than focusing intensely on one point or area in front of you, which can worsen tunnel vision, you can deliberately expand your gaze. By dilating your gaze, without moving your head or eyes, you start to take in a broader, more panoramic view of your environment. This shifts your focus from a narrow, stressful tunnel vision to a wider perspective. This simple adjustment in focus has a powerful effect on calming the mind. The brain has circuits in the brainstem that are tied to the body's alertness system. And by shifting your gaze in this way, you activate the calming pathways in the brain, which counterbalance the heightened alertness from the stress response. It's like telling your brain, yes, we are in a high output state, but we don't need to be mentally overwhelmed by it. You can try this technique during physical activities like running or cycling. For example, if you're sprinting or pushing yourself on a bike at 90% of your maximum capacity, try to widen your visual field. What you'll find is that your mind can relax, even though your body is still in full physical output. This is a way of dissociating the mental or emotional reaction from the physical activation. You're not forcing your mind and body to unify in a calm state. Rather, you're separating the mental response from the body's activation so you can function optimally. This technique is powerful, especially for those in high-stress environments like sports or the military, where high levels of activation and alertness are needed. It's about raising your stress threshold so that you can stay in high alertness, but with a calm mind. Over time, by practicing this technique during your workouts, perhaps once a week, you'll become more comfortable with these higher activation states. What once felt overwhelming and exhausting can become manageable and tolerable. For medium-term stress, tools like deliberate breathing, exercise, and gaze dilation can help you build resilience. These techniques raise your capacity to handle stress without being overwhelmed by it. And once you've mastered this, you'll find that stress becomes something you can handle rather than something that controls you. When we talk about medium-term stress, such as the stress of a busy month or a challenging week, it becomes much more manageable when we train ourselves to stay calm mentally, even while our bodies are in an activated state. For example, at Stanford, where they use a quarter system, 10 weeks of classes, stress can build up over the course of those weeks. But if we learn how to regulate our response to this kind of stress, we become better equipped to handle it. It's about training ourselves to stay mentally calm and focused, even when the body is under pressure. The tools I've described so far are not the typical ones you might think of when it comes to relaxation techniques. I'm not talking about sitting down for meditation or engaging in a non-sleep deep rest NSDR protocol. Although NSDR is fantastic for replenishing your ability to focus and lean into effort, I've covered it extensively in previous discussions. Today I'm talking about tools that allow you to dance with stress, to engage with it in a way that helps you reduce discomfort in the short term, manage heightened activation in the medium term, and ultimately avoid the pitfalls of long-term stress. Now, let's talk about long-term stress. This is where we have to draw the line. Long-term stress is not good for your body. You do not want adrenaline coursing through your system for extended periods of time. Ideally, you want stress to increase at various points throughout the day, but it should never remain elevated for long stretches, especially when it starts to impact your sleep. If you've ever had nights where your stress levels prevented you from sleeping well, you know how challenging it can be to function the next day. In fact, for me personally, even with all the tools I use to manage stress, I have about 3 to 4 nights a month where I don't get the quality of sleep I'd like. Life happens, and sometimes stress is unavoidable. But the key is managing that stress and getting back on track. For many of you, though, stress might affect your sleep even more frequently. You might find that stress keeps you up at night, and for some, sleep can be elusive for weeks or even longer. If that's you, know that you're not alone. And the good news is that it can be changed. Sleep is a critical component of managing stress, and there are tools available that help us build a healthy relationship with sleep. The goal is to fall asleep when it's time, stay asleep throughout the night, and if you wake up, be able to return to sleep as needed so that you feel rested and restored. If you're struggling with sleep, I encourage you to check out the episodes dedicated to sleep tools. Zero-cost solutions are available, and they can make a real difference in how you manage stress. Now back to long-term stress. I've mentioned before how breathing can influence heart rate through the sympathetic and parasympathetic nervous systems. It's essential to understand that controlling heart rate via breathing is actually the foundation of a process known as heart rate variability, HRV. HRV refers to the variation in the time intervals between heartbeats, and it is a crucial indicator of autonomic nervous system function. Specifically, how well your body can balance the sympathetic stress and parasympathetic rest responses. By improving your ability to control HRV, you can boost your resilience to stress, improve sleep quality, and enhance overall health. When we talk about heart rate variability HRV, we're discussing something incredibly important in understanding how the body manages stress. HRV refers to the variation in the time intervals between heartbeats. Contrary to what some might think, a low heart rate on its own isn't always ideal. For example, when you're in good shape, your heart can pump more efficiently, meaning it doesn't have to beat as fast to circulate blood. I remember when I was running regularly, my heart rate would dip to around 50 to 60 beats per minute, which is fantastic for heart health. But nowadays, since I'm running a little less, my heart rate has naturally gone up. However, what's critical here is that chronic elevation or suppression of heart rate is problematic. Having a chronically high heart rate, especially from stress, is dangerous. It leads to hypertension, high blood pressure, which is a well-known contributor to heart disease, one of the leading causes of death worldwide. In particular, Type A personalities, who tend to be high-strung, perfectionist, and work-oriented, often experience chronic stress that elevates their blood pressure and increases the risk of heart disease. The constant fluctuation of adrenaline in the bloodstream, which constricts some blood vessels and dilates others, wreaks havoc on your cardiovascular system. So chronic stress is indeed bad for your health. While it's crucial to recognize the negative effects of long-term stress, it's equally important to understand how to mitigate it. The goal is not to avoid stress entirely, but to manage it effectively. Short-term and medium-term stress can be helpful, as we discussed earlier, but you never want to be in a state of chronic stress for months or years on end. So how can we modulate long-term stress? Well, let's explore some tools and strategies. Exercise and good sleep are the most well-known ways to reduce stress. They have been shown repeatedly to help improve heart rate variability, lower blood pressure, and improve overall well-being. But the data also points to another critical factor in managing long-term stress: social connection. Strong social ties are one of the best buffers against the negative effects of stress. In today's digital age, we often substitute physical connection with online communication. We text, we DM, and we keep in touch through social media. But this doesn't always provide the same relief that in-person interaction does. Humans are inherently social creatures, and while digital communication offers convenience, it lacks the depth and quality of face-to-face interaction. There's something powerful about the physical presence of another person, which brings about a sense of emotional grounding that digital communication can't quite replicate. But don't just take my word for it. The science behind social connections and stress management is clear. Strong, meaningful relationships, whether with family, friends, or community, help to lower cortisol levels and promote a feeling of safety and support. Social connection also triggers the oxytocin response, which has been shown to reduce stress and promote relaxation. Now, there's a way to approach social connection that's based on scientific data, and not just feel-good theories. When we talk about connecting with others, it's not about surface-level interactions or simply checking in with someone online. It's about creating deep, meaningful connections that contribute to a sense of belonging and support. That's what really mitigates long-term stress. The presence of people who understand, support, and offer emotional security. While the digital world offers convenience, it's important to remember the importance of face-to-face interactions, where body language, tone, and emotional resonance can be fully felt. This deeper connection has a profound effect on stress reduction, and research continues to demonstrate the physiological benefits of strong social networks. For those of you who are familiar with, or even skeptical about, more New Age practices, like social connection and the release of oxytocin, I want to provide a bit of clarification. Many people claim that simply hugging someone, patting a dog, or exchanging a fist bump can release oxytocin, the so-called love hormone. However, it's important to note that oxytocin is released in more specific and intense circumstances, like during mother-child bonding, especially during lactation or after sexual intercourse. Oxytocin is deeply tied to bonding experiences and those that promote close, intimate connections. So, while we might feel good after a hug or when we greet someone, oxytocin isn't necessarily the driving force behind those warm feelings. Instead, what truly helps to mitigate long-term stress through social connection is the activation of other neuromodulators, like serotonin. Understanding this is crucial because it helps ground the idea of social connection in a more scientifically backed context, especially for those who may be less attuned to the language of New Age practices. Now, let's dive into the role of serotonin and other neuromodulators in stress management. Neuromodulators are like playlists for your brain. They guide your brain circuits, amplifying some and suppressing others. Serotonin is one such neuromodulator that plays a huge role in regulating our mood and stress. At higher levels, serotonin can make us feel blissful, content, and overall well-being. It signals to the brain that everything is okay in our immediate environment, reducing feelings of anxiety or fear. Interestingly, serotonin is one of the reasons why antidepressants that elevate serotonin levels can be so effective for people with depressive symptoms. However, there's a trade-off. When serotonin is elevated too much, especially with pharmacological intervention, it can have side effects, such as blunting emotions or reducing sexual desire. That's because, when there's too much serotonin, the body and brain might feel as though they have enough, causing a reduced emotional range. But outside of pharmaceuticals, serotonin still plays a critical role in promoting feelings of connection. When you interact with someone you trust, whether it's a friend, a family member, or even a friendly acquaintance, your brain releases serotonin, which helps you feel good. It also has positive effects on the immune system, contributing to better neural repair and synaptic health. This is crucial because serotonin helps reinforce connections in the brain, preventing the deterioration of these connections over time, which is common with chronic stress and social isolation. What this means for stress management is that social connection can trigger the release of serotonin, which not only helps you feel better emotionally, but also strengthens neural connections and supports immune health. In turn, these positive effects create a buffer against the negative impact of long-term stress. When you have strong relationships and social bonds, your body is better equipped to manage stress because of the continuous release of serotonin and its beneficial effects on your brain and body. In summary, while oxytocin plays a role in deep, intimate bonding, serotonin is the key to understanding how social interactions can help reduce long-term stress. When you engage in meaningful social connections, whether through quality time with loved ones or interacting with others you trust, you're activating serotonin, which reinforces both emotional and physical resilience. Social connection takes many forms, and it's not always about human-human relationships. Personally, I have a deep attachment to my dog, while he spends most of his time asleep, and I have no idea what he thinks of me. There's something profoundly comforting about the bond we share. It's not just about humans connecting with humans. Attachment can also extend to our pets, family members, or even things that bring us joy. Interestingly, there's no scientific evidence that suggests social connection is only effective when it involves human-to-human interaction. I value my relationships with humans, but attachments to other beings, whether they're animals or objects, can also be incredibly powerful. For instance, the bond between a pet and its owner can be just as meaningful and stress-relieving as human connections. The important thing is engagement and attachment, finding things or beings that delight us. One of the most effective ways to combat the long-term negative effects of stress is not just by having fun, as many wellness gurus suggest. The idea of fun can feel a little elusive, especially for those who are hard-driven or under a lot of stress. However, delight, that genuine joy or satisfaction you get from engaging with something you enjoy, activates the serotonin system, which helps reduce stress and improve emotional well-being. It's not just about having fun, it's about engaging in things that bring joy to your life. Whether it's seeing something beautiful, participating in an activity you love, or even interacting with a pet that brings you comfort, these moments of delight are incredibly powerful in mitigating stress. Social connection, in all its forms, plays a critical role in this process. But here's the thing, it's not always easy. Sometimes people might feel isolated or think, nobody wants to be my friend, or no one wants to engage with me socially anymore. The reality is that social connection takes work. Relationships, whether with people, animals, or even certain activities, require time and effort. It means sometimes being flexible, adjusting to other people's schedules, or doing things you don't necessarily want to do in the moment, like eating something you're not craving, or staying up later than usual. But despite the effort it requires, social connection is incredibly powerful. As Robert Sapolsky, one of the leading experts in neuroscience and behavior, often highlights, humans are primates and we are fundamentally social creatures. Throughout history, humans and other primates have lived in tight-knit communities, and our brains are wired for these deep social connections. However, in today's world, we interact with more strangers than ever before, and often, those interactions happen at a distance, which can leave us feeling disconnected. In his work, Sapolsky talks about how this increase in social isolation has profoundly impacted human well-being. We are more connected to people across the globe than ever before, but we're often not truly engaged with them. Social media and digital communication, while helpful, don't always replace the emotional depth and connection of in-person interactions. This is why finding a few key people, whether they are friends, family, or even a pet, can be incredibly beneficial. Even if it's just one person, or one being, or even an activity that brings you joy, it can have a tangible impact on your stress levels. These connections, however small, play an integral role in managing stress and maintaining a healthy emotional state. So don't overlook the value of social engagement, whether with humans or animals. Delighting in these connections is one of the most effective ways to maintain a sense of well-being, resilience, and joy in the face of life's challenges. In addition to social connection, there's also a biological factor that social isolation brings into play, something called Taqi Kynan. It's a molecule that, believe it or not, has been linked to increased fear, paranoia, and impaired immune function. You might not have heard of Taqi Kynan, but it plays a significant role when it comes to chronic isolation. When you're not spending enough time with people you trust or engaging in activities that bring you joy, your body starts secreting this molecule. In a sense, it's like your body is sending you a signal saying, you're not connected enough. You're missing something important. For someone like me, someone who is often goal-directed and constantly striving to accomplish things, it's easy to overlook the need for social connection. Sometimes I get so caught up in the pursuit of goals that I forget the importance of slowing down and making time for the relationships and activities that nourish me. To remind myself of this, I have a little post-it note above my desk that says Taqi Kynan. It serves as a gentle reminder that social isolation can have a profound impact on both my mental and physical health. When we're not socially connected enough, our bodies start to produce Taqi Kynan. This molecule functions as an internal punishment signal, creating feelings of fear, paranoia, and irritability. It's essentially a stress marker, signaling that something is out of balance in your social or emotional life. Long periods of social isolation, combined with elevated levels of Taqi Kynan, can deplete important functions of your brain and body, leading to negative outcomes like increased stress, impaired cognition, and even emotional instability. Now, while Taqi Kynan is something we want to avoid, it's also important to highlight the positive effects of social connection and how they help mitigate Taqi Kynan. One of the simplest ways to do this is by having long meals with friends or family, where there are minimal distractions, like phones or other devices. Even if there are some interruptions, just feeling connected to others is enough to help suppress Taqi Kynan. These moments of connection are biologically restorative, reducing feelings of stress and improving overall well-being. While oxytocin often gets the most attention in discussions about connection, it's important to remember that serotonin plays a much faster role in modulating how we feel in our daily lives. Serotonin is a neuromodulator that contributes to feelings of comfort, trust, and delight. These aren't just abstract psychological terms. They are deeply physiological. When you feel a sense of well-being or bliss, that's serotonin at work in your body, helping you regulate stress and improve your mental health. But how do you know if you're producing enough serotonin? In the moment, it's hard to tell. However, over time, you can recognize the effects of serotonin in your life. If you regularly experience feelings of comfort and contentment in your relationships or in activities that bring you joy, you're likely experiencing the positive influence of serotonin. And yes, one of the most effective ways to stimulate serotonin is through gratitude. Gratitude is a bit more subjective, but studies show that writing down things you're thankful for, even if they seem small, can positively impact your serotonin levels. This practice can make a real difference in your overall well-being. The more you focus on positive things in your life, the more you activate your serotonin system, which in turn helps reduce long-term stress and supports emotional balance. In summary, social connection is one of the most effective ways to modulate stress and increase well-being. The serotonin system, which governs feelings of trust, bliss, and delight, is key in this process, and by fostering strong social bonds, whether with friends, family, or even pets, you can effectively lower stress and build resilience to life's challenges. Managing long-term stress is not just about making the right lifestyle choices, like diet, exercise, and sleep. Although those are crucial, social connection, as we've already discussed, plays an essential role in helping us navigate and manage stress. But sometimes, due to the nature of life, we may need additional tools to help us cope with chronic stress. Not everyone has the luxury of being able to control every stressor in their life, and sometimes we need to seek external support to regulate our stress systems effectively. For some, non-prescription supplements can serve as a tool to modulate the stress response. It's important to note that I am not talking about antidepressants here. If you're considering or currently using prescription medication, it's crucial to follow your doctor's advice. However, there are certain over-the-counter supplements that can help reduce stress and anxiety without a prescription. Of course, always check with your healthcare provider before taking any new supplement, but these can be helpful tools in managing stress, especially for those who find themselves in chronic stress situations. One of the best resources for evaluating supplements is examine.com. This website provides a human effect matrix that links supplements to research studies published on PubMed, helping you evaluate the effectiveness and safety of supplements for various conditions. It's a fantastic tool for those interested in learning more about how certain compounds affect the body. Now, let's talk about 3 common supplements that are frequently used to modulate the stress response: ashwagandha, L-Theanine, and melatonin. I will explain each of these and give some insight into their effectiveness. Ashwagandha. This adaptogen has gained a lot of attention for its potential to reduce stress. It's been shown to lower levels of cortisol, the hormone responsible for the stress response. As an adaptogen, ashwagandha helps the body adapt to stress and reduces the negative impact that long-term stress can have on the body. People often find it useful for managing anxiety and promoting a sense of calm without causing drowsiness. L-theanine, found primarily in green tea. L-theanine is known for its calming effects. It works by increasing serotonin, dopamine, and GABA, neurotransmitters that promote relaxation and reduce stress. Unlike other calming agents, L-theanine does not cause drowsiness, making it an excellent option for daytime use. It helps you stay calm and focused, especially when you need to tackle challenging tasks without feeling overwhelmed. Melatonin. Melatonin is a hormone produced by the pineal gland that plays a crucial role in regulating the sleep-wake cycle. It's typically secreted in response to darkness and helps you fall asleep. However, melatonin does not help you stay asleep. It's often taken as a supplement to assist with falling asleep quickly, especially in people who have trouble adjusting to different time zones or who work irregular hours. However, I want to caution against supplementing with melatonin, especially at high doses. Most melatonin supplements are sold in doses ranging from 1–3 milligrams, which is often much higher than what your body would naturally produce. This can lead to potential side effects, including disruption to the reproductive system and other hormonal imbalances. While some people can take melatonin without any issues, it's not always the best solution for everyone. In summary, while supplements can be useful in helping to regulate the body's stress response, they should always be used with caution and ideally under the guidance of a healthcare professional. I personally prefer to use ashwagandha and L-theanine for stress management, but it's important to find what works best for you. And don't forget, social connection is one of the most powerful natural ways to counteract stress. So be sure to invest in relationships, whether human or animal, to help maintain balance in your life. Now let's take a moment to discuss the potential issues with melatonin, particularly for those who are considering it as a sleep aid or for other stress management purposes. As mentioned, melatonin is a hormone produced by the pineal gland in response to darkness. While it can be an effective way to help you fall asleep, it's important to note that taking too much melatonin or taking it chronically can have negative effects on your adrenal glands and overall health. First, melatonin does not help you stay asleep. It's primarily useful for falling asleep, but when taken at high doses, 1 to 3 milligrams or more, it can suppress the body's natural production of other key hormones like cortisol and epinephrine, which are essential for managing stress and responding to various physical demands. Over time, this can have a negative impact on the adrenals, potentially leading to pseudo-adrenal insufficiency syndrome. This happens because melatonin can interfere with the adrenal gland's ability to produce cortisol and adrenaline, hormones that help the body manage stress and regulate other bodily functions. It's worth noting that there is a common misconception in popular culture about adrenal burnout. The idea of adrenal burnout, that your adrenal glands can become overworked and stop functioning properly due to chronic stress, is largely untrue. The adrenals are capable of producing enough adrenaline for decades of stress. The concept of adrenal burnout has roots in the work of Hans Selye, who studied stress and developed the general adaptation syndrome. While his work was groundbreaking and accurate in many ways, his theory that chronic stress eventually leads to exhaustion and adrenal burnout was incorrect. Instead, chronic stress may leave you feeling exhausted mentally and emotionally, but it's not because the adrenals have burned out. The adrenals themselves are still capable of producing adrenaline, unless there's a specific condition like adrenal insufficiency syndrome, where the adrenals do not produce enough hormones. This misunderstanding has contributed to the idea that high levels of melatonin can lead to adrenal burnout. While melatonin is unlikely to cause true adrenal burnout, it can suppress the adrenal gland's ability to produce cortisol and epinephrine when used inappropriately. If you are considering melatonin for stress management or sleep, it's essential to be mindful of its long-term effects. Consulting a doctor about appropriate dosages and potential side effects is always a good idea, particularly if you have any concerns about adrenal health. Now, let's discuss L-theanine, which is another supplement that can help with stress management, especially when it comes to improving sleep quality. L-theanine is an amino acid commonly found in green tea. It has a calming effect on the brain and can help people relax without causing drowsiness. The great thing about L-theanine is that it increases levels of gamma-aminobutyric acid, which is an inhibitory neurotransmitter in the brain. GABA helps to reduce the activity of the forebrain, which is the part of the brain responsible for thinking, rumination, and stressful thinking. When taken in moderate doses, typically 100 to 200 milligrams, L-theanine can be very effective at helping people transition into sleep more easily and enhance the depth of sleep. It doesn't make you drowsy during the day, but it can help you unwind and feel more relaxed. For people who struggle with overthinking or anxiety at night, L-theanine can be particularly useful. Taking it about 30 to 60 minutes before sleep can improve the overall quality of your rest, making it a good option for those who have difficulty shutting off their thoughts at night. In conclusion, when it comes to managing long-term stress, supplements like melatonin, L-theanine, and others can help, but they need to be used mindfully. Melatonin can be helpful for falling asleep, but it should be used cautiously to avoid suppressing the adrenal glands. On the other hand, L-theanine offers a great alternative for relaxation and improving sleep quality without the risks associated with melatonin. L-theanine, a compound often found in green tea, has several benefits when it comes to managing stress and anxiety. While it's most commonly known for its ability to help people fall asleep, L-theanine has also been shown to reduce chronic anxiety in multiple studies. Research available on Examine.com reveals that L-theanine significantly increases relaxation and has a minor effect on reducing anxiety. In fact, there are 8 studies that confirm its positive impact on anxiety levels, making it a great tool for those who deal with ongoing stress. L-theanine is not just good for general anxiety. It has also been shown to help with task completion anxiety, the kind that can make simple tasks feel overwhelming. For those who are chronically stressed, L-theanine can provide a gentle relief, helping you calm your mind without making you feel drowsy. In addition to its effects on anxiety, it can also slightly lower blood pressure, improve sleep quality, and enhance attention. In short, L-theanine helps manage stress in a practical, non-intrusive way. For myself, I often find that if I'm feeling particularly stressed or haven't been managing my stress well throughout the day, taking a bit of L-theanine in the late afternoon helps to blunt the stress response. This is especially useful when I feel like I haven't accomplished enough during the day and my mind starts racing. It's also why some energy drinks now include L-theanine. It's meant to provide a sense of calm alongside the usual boost. However, I'm not a fan of most energy drinks, especially those that contain taurine. Some people may love taurine, but I personally find it doesn't work well for me, as it can cause issues with my microvasculature, particularly in my eyes. While taurine may have its benefits, I recommend being cautious and finding what works best for you. In addition to L-theanine, another supplement that can be incredibly beneficial for managing stress is ashwagandha. Ashwagandha is an adaptogen, meaning it helps your body adapt to stress and restore balance. It's especially useful for lowering cortisol levels, the primary stress hormone. There are 6 studies that show ashwagandha's ability to significantly reduce cortisol levels, which is particularly helpful for those who have chronic stress or anxiety. While cortisol is essential in the morning to help wake you up and start your day, chronically elevated cortisol is associated with many negative health effects, including increased stress, anxiety, and even weight gain. Ashwagandha can be incredibly helpful for those looking to lower anxiety while managing the physiological impacts of chronic stress. By reducing cortisol, ashwagandha helps to rebalance the body's stress systems, making it a useful tool for anyone dealing with long-term stress or feeling overwhelmed by daily demands. In summary, supplements like L-Theanine and Ashwagandha can be helpful tools in managing stress and anxiety. They work in different ways, but are both effective for calming the body and mind. L-Theanine is great for reducing anxiety and improving relaxation without drowsiness, while ashwagandha helps reduce cortisol and support the body in adapting to stress. As always, make sure to consult with a healthcare professional before adding new supplements to your routine. When we talk about ashwagandha, it's important to highlight the effectiveness of this adaptogen in reducing cortisol levels. Examine.com reports that in 6 studies, ashwagandha led to a 14.5% to 27.9% reduction in cortisol levels in stressed but otherwise healthy adults. This is significant because cortisol, the body's primary stress hormone, is a major contributor to chronic stress and its associated health problems. By lowering cortisol, ashwagandha can help protect against the long-term effects of stress. However, it's important to note that ashwagandha is not something to take continuously year-round. I personally only use it during periods of high stress when I feel like I'm struggling to manage my day-to-day stress effectively. The great thing about ashwagandha is that in addition to reducing cortisol, it has been shown to have several other positive effects. There are 5 studies that demonstrate reduced stress, which can manifest in areas such as fatigue, cognitive impairment, and other stress-related symptoms. Additionally, ashwagandha has been linked to lower cholesterol levels by about 10%. This may or may not be a benefit, depending on individual health goals. It's worth noting that cholesterol is important in the synthesis of hormones like testosterone, estrogen, and cortisol. Therefore, while lowering cholesterol slightly may be beneficial, it's important to ensure it doesn't drop too low, as this could have negative effects. Ashwagandha also shows mild effects in treating depression, likely due to its ability to reduce stress and improve overall mental well-being. Personally, I use ashwagandha intermittently, mainly when I'm feeling particularly stressed, but not on a regular basis. It's a helpful tool in the toolkit for stress management, especially when you need to combat chronic stress or burnout. Another supplement I mentioned earlier is L-Theanine, which can be helpful for relaxation, but isn't something I use during the day unless I'm feeling chronically stressed. When it comes to stress management, tools like breathing exercises, gaze dilation, and social connection are the primary methods I rely on. In addition, good sleep, a balanced diet, and regular exercise are essential components for managing long-term stress and maintaining emotional well-being. Examine.com is an excellent resource to evaluate any supplements you're considering. It provides links to PubMed studies and a comprehensive breakdown of supplement effectiveness, so you can be sure you're making informed decisions. In conclusion, managing stress, whether in the short term, medium term, or long term, requires multiple strategies. It's not just about mitigating stress, as stress will inevitably occur in life. The goal is to modulate and control stress using tools like respiration techniques, gaze dilation, social connection, and supplements when appropriate. We will continue discussing these tools and their role in emotion regulation in the next stages of this series. As we dive into the topic of emotions, it's important to recognize that emotions are complex and multifaceted. There isn't just one brain area responsible for any of the emotions we experience. When we try to understand emotions, it's crucial to approach them from multiple perspectives: neuroscience, psychology, and culture. One of the most influential voices in this area is Lisa Feldman Barrett, a world-renowned expert in emotion at Northeastern University. She has written 2 books that are incredibly insightful: How Emotions Are Made and 7.5 Facts About the Brain. Lisa's work is deeply rooted in the idea that emotions are context-dependent. They are influenced by our internal states and the demands placed on us. While I look at emotions from a physiological and neuroscientific perspective, her work aligns with this in many ways. The key idea here is that emotions arise when our internal state, such as stress or calm, matches or mismatches the demands we are facing in the external world. Let me explain this with an example. Imagine that you are feeling anxious and stressed, and you have a long to-do list in front of you. This internal state doesn't feel good, and it's because your internal state, stress, doesn't match the demand of your situation, having to get things done. However, this is no different than being very tired and having a lot to do. In both situations, there's a mismatch between your internal state and the external demands. Whether you're too tired or too stressed, the emotional result is the same. It doesn't feel good. It's a situation where the internal state and the external demands are out of sync, and as a result, we interpret this situation as negative. On the flip side, imagine a situation where your internal state matches the demand. If you are tired and you need to fall asleep, that feels good because the internal state aligns with the external demand. But if you're wide awake and you need to sleep, that's a mismatch, and you'll likely interpret the situation as bad or frustrating. So the value or valence of the situation is determined not by whether you're feeling alert or sleepy, but by whether your internal state matches the demands being placed on you at that moment. This understanding of emotions can help us better navigate our feelings in response to stress or other challenges. It shifts our focus away from simply labeling emotions as good or bad, and instead helps us see that emotions are often the result of mismatch between our internal state and the world around us. This insight can be a powerful tool for managing emotions because it gives us a framework for understanding how to shift our internal state to better align with external demands. In the following episodes, we will explore how these emotional dynamics play out in specific conditions such as OCD, depression, and mania. We'll also talk about dopamine and its role in emotional regulation. But for now, it's important to remember that emotions are not just reactions. They are complex, context-dependent responses to how well our internal state matches the demands of our environment. The relationship between our internal states, whether it's alertness, stress, or sleepiness, and the demands we face, is a crucial framework for understanding and managing emotions. Whether we are dealing with stress, feeling drowsy, or trying to fall asleep, the key to handling these feelings lies in understanding how our body's autonomic nervous system works. This system controls everything from calm to stress and even to panic. It also governs states like drowsiness or tiredness, and in extreme cases, even a coma. What's important here is recognizing that you're constantly on this seesaw of internal states, alert or calm, stressed or sleepy. Where you are on this scale greatly affects how you react to the external demands placed on you. For instance, if you're about to have a job evaluation or a difficult conversation with someone, you might anticipate feeling anxious or stressed. If you're overly stressed or alert, it can cloud your ability to listen and process the conversation. Here's where the ability to modulate your stress response becomes vital. By calming down a bit before you go into a high-stress situation, you put yourself in a better position to hear the information being shared. especially if it's something critical like feedback. A simple tool is to close your eyes. This may sound odd, but closing your eyes during a tense conversation helps to focus on the content of what's being said, rather than getting caught up in emotional reactions or nonverbal cues. It's your permission to not feel pressured to maintain direct eye contact if it helps you process the conversation more effectively. The ability to modulate your stress can enable you to react thoughtfully, not impulsively. The focus isn't just on being reactive, but being responsive, and that's a powerful skill. Pop psychology often encourages people to be responsive. But how do we actually do that? The answer is real-time stress modulation. This means adjusting your internal state in the moment, rather than waiting to meditate or take a break before addressing something important. Stress will always be present, but the key is learning how to manage it while still engaging with life's challenges. For example, mindfulness is often touted as a solution. But how do we practice mindfulness in our daily lives? For me, the concept of mindfulness can sometimes feel abstract. When you're moving through your day, especially when you're busy, it's easy to just focus on getting things done. But when you monitor your own experience, it becomes easier to step back and make conscious decisions on how you react. Mindfulness, in this context, isn't about formal meditation. It's about awareness in real time, awareness of your emotional state, and adjusting it so that you're better equipped to handle the challenges at hand. By learning how to manage your stress response as it happens, rather than relying on a long meditation session or waiting for the right moment, you start to reduce reactivity. This enables you to face difficult situations with a clearer mind, making better decisions and reacting effectively. This is one of the key ways to move through life with greater resilience and clarity. When it comes to stress, we often hear advice about being mindful or observing ourselves in the moment. However, for some, including myself, this type of mindfulness doesn't always help. Sometimes, the observer role, which is often part of mindfulness, can actually hinder my focus and effectiveness. Instead of being caught up in observing myself, I need to focus on the task at hand and then be able to disengage when it's time to rest. This ability to transition between focused work and rest is key to feeling effective and balanced in life. For example, I may work hard on a task until 9:30 p.m., but then I'm able to put my head down at 10 p.m. and fall asleep by 10:02 p.m. This may seem like an impossible feat, but it's possible when you've learned how to control your stress response effectively. It's not about using the mind to force calmness. It's about using tools to manage your body's response. Many people feel grumpy, anxious, or depressed, and while some of this may be linked to underlying neurochemical issues, much of it comes from being overworked or poorly rested. Life can sometimes feel like it's bearing down on us, but we don't need to view it subjectively. Instead, we can look at it from an objective physiological standpoint. What tools can we use that are anchored in physiology? How can we leverage our body's neuronal systems, including the autonomic nervous system, eyes, diaphragm, and other parts of our physiology, to modulate our stress response and give us a sense of agency and control? We want to feel like we have control over our internal landscape, because when we can control this, we can navigate the world with more calm and clarity. This shift in perspective, moving from a subjective to a physiological understanding of emotions, sets the stage for understanding how emotions like happiness, joy, and awe are grounded in the autonomic nervous system and how they relate to our ability to modulate stress. These emotions, and our ability to experience them, depend on how well we can manage our internal states. Stress is a powerful force in life, and understanding its role in various contexts helps individuals navigate it more effectively. While stress can sometimes be an impediment, especially when it becomes chronic or misapplied, its proper management can yield significant benefits. By recognizing stress as a tool, one can leverage it to handle work demands, improve sleep, and foster better social connections. Life will always present uncontrollable events, but how an individual responds to those events is something that can be controlled. Effective stress modulation is not about avoiding stress altogether, but about knowing when to activate or reduce it. As discussed, tools like breathing techniques, gaze modulation, and social connection can aid in this regulation. These tools allow individuals to better handle stressful situations without becoming overwhelmed. By applying these tools, it's possible to navigate life with a greater sense of agency and control over one's emotional state. Understanding the relationship between stress and emotions is foundational for emotional regulation. By gaining insight into stress modulation, individuals can improve their responses to external demands and manage their internal experiences in a more balanced way. If you found this information helpful, don't forget to like and share with anyone who could benefit from learning how to navigate stress more effectively. For more insights on emotional health, stress management, and well-being, be sure to subscribe to the channel. Join us as we continue exploring practical tools and knowledge to help you live a more balanced, healthy life. Thank you for your time, and remember, how you react is always within your control.